Hello, my name is Doreen Edgar and I am a heart failure patient who has been involved in research. When Andrew asked me to say why I thought patient representation was important, I didn't hesitate to agree with him for the following reasons. 1. I have the knowledge of how 4 generations of my family have been affected by cardiac disease in different ways. Secondly, I am qualified as a radiographer. I understand most medical terminology and I ask if I don't. Thirdly, I am a member of 2 support groups, Darlington Coronary Support Group and Supporting Hearts, which is a heart failure support group. Fourthly, I've always been interested in any ongoing medical research, but in particular the research which was of specific interest to me is cardiovascular research. I've always been looking for a solution to my problems. Fifthly, and importantly, it fills a need which I have in feeling useful again. Unfortunately, I had 2 heart attacks and heart surgery in less than a year. I didn't recognise my symptoms as being angina, as they only appeared when I was at rest. Both my parents and grandparents died of heart disease, and I thought that I'd taken all of the measures that I could to ensure that my family had healthy hearts. As you might imagine, I immediately suggested that my 2 sons had their cholesterol count. And sure enough, my oldest son David had a very high cholesterol count. He took statins for 12 years and then quite suddenly he died last year at the age of 42 from a heart attack. I was already involved in the end-of-life research, in the end-of-life pathway research for heart failure patients when David died, because I thought that any research was going to be beneficial to both my sons. His death has made me more determined to help in any way that I can, especially for David's son, my grandson Martin. In Darlington we have a heart failure support group, and I always keep the group informed of the research that I am involved in and any that our heart failure nurses are doing. Later on, our heart failure group is going to take part in another piece of research into the diagnosis and treatment of heart failure in patients. Even within our very small heart failure group, the quality of the diagnosis and of the treatment varies. This is partly due to cost. Some practices don't spend as much as others on heart failure patients. It is enlightening to listen to a small group of 14 people and to hear the different ways that they have been diagnosed and assessed. Their understanding of their illness varies from complete appreciation and understanding to one lady who announced that she was now cured and shouldn't be a member of our group. Unfortunately, heart failure is a terminal illness and as such can't be cured. We've come a long way since we started the group, and this has been mainly due to the discussion and to education and to the presence of our heart failure nurses. I benefit from being involved in research in many ways. I'm aware of cardiovascular disease being researched at this moment in our area. I can't do many of the things that I liked to do previously, but I can sit and listen, and when asked for my opinion, I can say what I think, or ask questions if I don't understand. I can make a difference. After all, I am a patient, and all of this research is for me. Any input I might offer is from a patient's point of view and seen through a patient's eyes. The end-of-life pathway is something I feel very strongly about. I do not want to spend the rest of my days of my life away from my family, being looked after by people who neither know me nor I them. I want my views and my family's views taken into consideration. It is very reassuring to me to observe the meticulous attention to detail and the lengths taken to ensure the security of data collected, to work with and listen to physicians and hear their concerns of not getting it right and looking for better ways to come to a good diagnosis. That means such a lot to me as a patient. The knock-on effect to others and the benefits they gain from it are many. I always tell our heart failure group of the areas of research which are ongoing, and this always initiates discussion. This has added strength to our group. From this there are many questions to ask and to be answered, topics where we might need to go to an expert to get our answers if our heart failure nurse can't help us. Being with other patients and hearing their symptoms and their problems and how they cope is very reassuring. You're not alone. Getting to know what is out there and how you might benefit from it, hearing other patients' points of view, widens an individual's outlook on their disease. Carers should contribute to research. They have a unique insight into the needs and welfare of the patient. I couldn't manage without my carer, who is my husband. Without him, my life wouldn't be as easy as it is now. He observes symptoms that I miss and is more honest in describing them than I am. I hope that my involvement in 3 research projects has made some difference. The first research project that I was involved in is end-of-life long-term care. I've already mentioned how strongly I feel about this and the unknown territory at the end of my life. The second project is heart failure in older people in care homes. I was my 93-year-old godmother's carer, and she was very well looked after physically. But I was able to say that there were some areas I felt some concern, and that was in the diagnosis and treatment when she was ill. The third project was closing the gap, improving the diagnostic process for heart failure patients. As a patient, you are only aware of your symptoms and how they were diagnosed. But with our heart failure group, I became aware of the vast differences in the diagnosis and treatment of such a small group of people. This is an opportunity not to be missed. The openness with which I have been accepted is refreshing. I have been made to feel that I am an important member of the team. What I have said has been treated with respect. How much of what we really feel is ever revealed to our doctors and nurses? Patient representatives can make a difference. I want to be there. I want to be even more involved and make more of a difference. It has also been brought to my notice just how difficult it is to get funding for research, and that is another area in which I am happy to be involved. What a waste of the knowledge and experiences which is out there if patients are not involved in research. Thank you.